Hi, everybody. I am so excited to have you here joining us with my friend, Dr. Christopher Calarco. I had the great pleasure of meeting him over coffee while I was at Parker, Las Vegas in February. And let me just say, we had a great time. And he was an absolutely fascinating person, has an amazing story. And I couldn't help myself. I had to book him on the very next webinar that we were having, our very first available date, which just so happened to be today. So I was so excited that he was able to join us. He is currently the executive and managing clinic director of accident treatment centers. He's been involved in the treatment of thousands of PI patients, which I'm sure you could have guessed by the name of today's presentation. He's trained and managed 40 plus chiropractors in personal injury treatment, marketing, and management. He got his undergrad degree from the University of Las Vegas back in 2005 with a bachelor's degree in biology and a minor in biochemistry. See, he is adorable and smart. He has a chiropractic degree from National University of Health Sciences, completed post-grad hours for whiplash injury, biomechanics of traumatology, Cox flexion distraction technique, active release technique, strength and conditioning, and functional movement systems. Like I said, adorable and smart. And I am so excited to have you here today. Thank you so much, Dr. Calarco.
Thanks for having me. I'm excited to present.
Well, it is all you.
All right. Sorry, everybody. It's my first webinar. I'm a little rusty, so I'll take it from here. As the time, we're going to discuss how to 120 PI cases per month in under 5 years. That whole time spending less than $1,000 each month on marketing. So I just wanted to take a moment to thank everybody for attending. My goal here is to bring you some real value during our brief time together. I really want to focus on the specifics of personal injury, how you need to learn these specifics as a chiropractor, and how to cut through all the noise in what can be a complex and confusing patient niche if you aren't prepared. So first and foremost, PI just shouldn't be this hard, but for so many it is. And that's because it takes not only knowing the general concepts when it comes to PI patient treatment, marketing, but like everything else, you want to be an expert in this space. That comes with having a firm grasp on the specific details and subtleties that affect outcomes when it comes to payment, volume, and even treatment. So today I want to touch on a few topics to really help the following doctors. You might find yourself in one of these categories. One of them is going to be a physician who's out there who just has no consistency in PI cases. Those obviously want to enter the PI space, would like to see additional PI patients into their practice, but just don't know how to do it. The second population I'd like to speak to is the doctors out there who have PI patients, but just aren't sure how to manage them. In other words, how to actually build a solid medical and legal case that's going to get the best patient outcomes and the best legal outcomes, which leads to the best payment outcomes in most cases. Third doctor out there I want to talk to is for those clinicians that get zero or few attorney referrals or recommendations as the expert in PI treatment in your area. And finally, the fourth doctor I want to speak to out there is the doctors who can't afford your own, can't find your own cases, whether they have legal representation or not. And finally, I want to discuss specifically for those doctors out there that do get PI patients who are not following through with treatment, which is a big problem in personal injury. When patients don't follow through with treatment, it ends up hurting their outcomes medically. It hurts the legal case and can actually hurt your connections, especially with the medical community, and the legal community, and with future referrals. So as we touched on before, this is a very noisy space. There are many people looking for or promising shortcuts. As the title states, we are actively seeing this much volume in new and treating PI patients. It has given us some real world and practical insight into what's really important. We really focus on 12 pillars when it comes to personal injury, how to treat, how to manage, how to market, and all aspects of the case start to finish. Today, we're going to kind of touch on 3. Before we do, though, I just want to give you some context, and let me give you a quick few-minute primer on my story, my path, who am I, for some context. I think I'll make it brief so we can jump right in. So I graduated in 2010 from National University. I got out of practice. I Started an associateship downtown Chicago, right on Michigan Avenue. It was a very, very useful experience as far as learning the medical side of chiropractic. But first, I should say one of the primary, excuse me, I'm a little nervous. So one of the first things I've actually learned was the important experience of getting medical referrals. This clinic focused specifically on Cox flexion distraction technique, which means we got a lot of medical referrals from neurologists and OB-GYNs that were in the building. We had a ton of new patient referrals that were pregnant patients, non-surgical cases that really, really needed spinal decompression. Many of those medical providers were actually in the building that we worked in. After that associateship, I ended up moving back to Las Vegas. It was time to move on from that Chicago practice. I wanted to go out on my own, and financially, it was just time to move on. Much of my family lives in Las Vegas, and my goal was to move and start a practice there. However, it's funny because life has a way of changing your plans. I had always worked, even while in chiropractic college, and in 2007, I thought it was a good idea to buy an investment property and rent it out. That was a disaster. The housing market takes a dive, with Vegas being particularly bad. And by 2010, I can no longer afford the house, the loss every month. I'm forced to short sell, like right as I'm getting out of chiropractic college. Which, as you can guess, you know what happens next. I go to take out a loan to start a practice. Due to the short sell, I am laughed out of the bank. It's a super low point in my life. I have no money. I'm not working in a profession that I love. And in hindsight, I will say that that door closing opened up a new path for me. I applied for associate position in Las Vegas, meet my now business partner, Dr. Fine, and so starts my path into the PI world. Dr. Fine had 30 plus years of experience in personal injury. He was looking to expand into Chicago, and after seeing I lived there, wanted to meet. So back to Chicago it is. I start making trips in the beginning every 2 weeks. I spend 2 weeks in Chicago, 2 weeks in Las Vegas, just to build connections, borrowing a friend's car during the day, sleeping on the couch, hitting every meeting I can, networking as much as possible, and then going back to Vegas for 2 weeks to make as much money as possible to finance this whole operation. So when we got started in the Chicago market, we started with zero. I mean, literally zero. We had no money. We had no connections, except for one possible referral source, which didn't pan out for over a year. And we knew none of the real players in space. So here I am. My whole job is to build this business, build these ties. Everything's bootstrapped, just using my sweat equity and his PI experience that I'm picking up as we go through this process. So after 4 to 5 months of back and forth, I rent a room, throw a mattress on the floor, and get to work every single day. And here we are. So that's my backstory. After 5 years, we are dialed in when it comes to the personal injury space. We know how to put the pieces together and put them in place when it comes to treating, getting, retaining PI patients, including online and offline strategies, while focusing on the patient care, which is the most important, and building our referral network. So the pieces of that are what we're going to discuss today. Like I said before, there's 12 basic pillars. Today we're going to touch on 3 of them. So let's just dive into this stuff here. So the first pillar is going to be case management that we discussed today. Case management is going to be an extremely important part of doing PI the right way. You need to know the rules to play the game. You need to play the game well, and you need to get the outcomes you want. So there are so many costly mistakes that can be made if you don't have or know the details regarding how to basically treat a PI patient, how to work with the medical providers, what to even do with a fresh PI case, or how to work or communicate with the legal teams when it comes to the patient that has representation. So just like getting referrals into your clinic for health-insured new patients, word of mouth and your reputation are important. Becoming an expert in PI can either make or break you with the adjusters, with auto insurance companies, with the medical network that we're going to teach you how to set up, and with the legal community, which ultimately could be a huge source of new PI patients into your practice. So understanding the medical algorithm. Once you understand how all these pieces come together and what's best for the patient to provide the best medical and legal outcomes, you are in the 1% of doctors in this space. You really need to know the specifics of what you're doing, where you're positioned as the chiro and how to work with medical providers, which are crucial for the patient care and to bring the most value to each case. So you are the quarterback of the case. As the chiro, you're the quarterback on the case. Clinically, you should be the patient's advocate. You should shepherd that patient through treatment, not only your treatment plan, but the entire treatment plan, and that means the medical care as well. This keeps things organized and streamlined. It helps you keep your pulse, your finger on the pulse, rather, of that PI patient and know exactly what's going on. As you build the medical case, you'll get the best medical outcomes, which in turn will give you the best legal outcomes. As the chiropractor, you're like in a prime position to not only call many of the plays, but implementing them and take charge of all the legal correspondence regarding patient care and anything else that has to do with patient compliance, so that legal teams are fully up to date on patient progress, treatment recommendations, and the need for diagnostic testing, specialist consults, etc. And that's really why co-management is going to be so important. All right, so let's jump in here. Talk about day one. It's going to be some red flags and just what to do generally on day one when it comes to personal injury patients. I think first it's probably a good idea to start with why co-management with medical providers is so important. And I think co-management and treatment with quality medical providers will, in many cases, improve both the medical and legal outcomes like we've discussed. Comprehensive care equals case building equals value for every single person involved. That's patient, that's you, and that's going to be the attorney. And those are the three real portions or players when it comes to a personal injury case. The value to the patient is going to be as they receive specific and personalized comprehensive treatment from each type of healthcare provider. Each one of those providers is going to work together to drive positive medical and legal outcomes. The value to the attorney, as their client got detailed and documented comprehensive medical care with corroborating medical notes, including imaging, all pointing to likely pain generators. That's going to build the patient's story. It's going to build the story of their injury, what they've been through, what their process was, what it looked like post-accident, going through the entire treatment process and how they ended up, and how that accident could have affected them after the accident. So there's going to be a lot of value to you in several ways by working with the medical community. The network of medical providers is going to be a huge resource for all the patients. So that's definitely on the PI side. We see a lot of patients that come in with, I don't want to say catastrophic injuries, but pretty significant injuries, I'm sure, like much of you in practice, and having those resources to send them out appropriately makes a lot of sense. The settlements on the PI cases are actually going to be better. Again, not to keep saying the same thing, but when you build that legal or that medical case, you are going to increase the value on the legal side. Networking with the medical providers is also going to provide a lot of referrals, both PI and non-PI for medical providers. We get a ton of not only PI referrals from medical providers that are in our network, but insurance-based patients. I mean, once they recognize your skill set, they trust you, they're used to dealing with you, they see how organized you are, how dialed in you and your team are, and the results, I mean, you're the go-to for lower back pain, spinal conditions, and many other things. It also allows you to provide the highest level of comprehensive care. You're learning a lot from working with medical providers, in my opinion, between the conference calls that you have, going over diagnostic imaging, patient protocols, etc. I think it's also important to mention that you're going to increase the PI referrals that you get in the long run because you're standing out in this specific niche. I think the lawyers will take notice of a lot less headaches, the excellent treatment, and likely the better settlements. So that was a little primer on why to kind of dive in with a network. Let's go day one and discuss protocols. So we're going to divide this up into spinal and extraspinal protocols today. For the spinal protocols, you're going to have catastrophic injuries, after an MVA in some cases, but the vast majority of them likely will not end up in your office. I mean, you are going to see it, so be prepared. However, you must rule out any serious pathological condition that may require immediate referral for further investigation or surgical intervention. Some of the most common spinal injuries deal with discs, facets, spinal muscles, and ligaments. We see this every day in practice. It's really important to identify impaired motor control, movement dysfunctions, sensory motor impairment, nerve tissue pathology, and especially related connective tissue dysfunctions on that initial visit. So you're going to be looking out for those red flags immediately. If there is a red flag, you're going to send the patient out for an immediate referral for advanced diagnostic imaging or a neurosurgical spine orthopedic consult. Some of those red flag findings could include, and I'm not going to go through a very detailed thing here because I don't want to dive into the weeds, but profound motor and sensory weakness, upper and lower extremities, bowel or bladder dysfunction, saddle anesthesia, or any kind of extremity neurological deficit. So let's say after that first visit, there are no red flag findings. So great, we can go ahead and proceed with just conservative care and any imaging that's needed. At the bare minimum, I would consider doing an X-ray given the trauma. It's really important too when you're deciding on whether or not to obtain diagnostic imaging, especially at that initial visit, to remember when the initial date of the injury was. If you're just because your first date of service might be a specific time, there could be a huge front end gap from when the accident happened, how long they're dealing with with this pathology until now. It's also going to be extremely important if there was no ER visit, or let's say this person was in an accident and you're the first point of contact, potentially to get them to an MD consult for medications. In some states, it might be easier as far as on the payment side for them to write you a script for physiotherapy 2 to 3 times a week for 4 weeks, and then see how they do with that. It's really hard for adjusters to argue that fact. And for spinal injuries specifically, we use a lot of pain management docs as the initial MD consult on some of these cases. We do it for several reasons. One of them is just going to be that the patient is seeing a single provider. If they need that spinal consult later with pain management, they already have a rapport. They're going to be getting all their meds from a single provider. Rapport has already been built. And if eventually conservative care fails, what will happen is they will already have a rapport built with somebody who does facet joint injections or epidural injections. So pain management is going to be extremely important when it comes to spinal pathology. Next, on that initial visit front, I just want to jump into some extra spinal protocols really quick because you're going to see a lot of these if you're dealing with personal injury patients. So extremity injuries are extremely common. Fractures of the clavicle, sternum, injuries in the shoulder, the hand, the wrist, multiple pathologies due to the seatbelt, due to the upper extremities flowing around during the accident. Many people injure their hips, their knees, their feet, their ankles due to hitting the dashboard or the interior of the vehicle. Also, we see a ton of concussions and other pathologies related to head trauma. That's something you really need to keep an eye out for, and it's something that I think is extremely underdiagnosed. Keep an eye out for asymmetry, bruising, swelling, and posture. So during that initial visit, if they do have a red flag, you're going to send them out for advanced diagnostic imaging into a specialist. And if not, you're just going to go ahead and continue the conservative care, MD consult, especially if no ER visit, definitely in case they need medications or a script for therapy. So that was the day one in a nutshell, as fast as I could get through it. And I hope everybody's following. Next, we're going to talk about the re-exam. The re-exam is always done at 8 to 12 visits or 3 to 4 weeks, depending on your specific treatment protocol. If there's significant improvement in the subjective and objective findings, great. Then you're just going to continue conservative care only. If they do need an MD follow-up for medications, for therapy, this is the time to do it. However, if they are not significantly improved, you can't pin down the pain generator, which is going to be extremely important when it comes to the documentation of a PI case. Then you should really pull the trigger, both medically and legally, on a advanced diagnostic imaging. And we'll just jump into some MRI real quick. So if the MRI is negative for a specific pain generator, you're going to continue the conservative care with possible pain management or an MD, and have them follow up with medications as needed, or just scripts for therapy. Now, however, if there's spinal pathology and you have a positive MRI with tears, you guys understand what I'm saying, you definitely want to send them out to an orthopedic, hand, wrist, podiatrist consult if warranted. So those re-exams need to happen every 8 to 12 visits, 3 to 4 weeks. This is a great spot for you to reevaluate how the patient is progressing, to update the attorneys, and to make sure you are laying out the proper treatment protocols. All right, when to use digital imaging or testing. So we're going to dive into X-ray quickly. I think it's the bare minimum imaging that needs to be done. Again, given the trauma and forces involved in auto accidents, X-rays are warranted as a baseline. You can see the Canadian C-spine rules for reference material. I think X-rays are most commonly used. Not enough. I'm sorry, I lost my spot there. Not enough when it comes to personal injury, actual diagnosis and treatment. We have several cases that we've gotten from other providers where no X-ray was even taken after a significant auto injury, which is a little scary. So, and then when we dive into MRI, I mean, typical uses for soft tissue injuries, herniated discs, torn ligaments. Why to order an MRI? MRI is going to help document the pain generator as discussed. The MRI findings can affect the treatment recommendations, as you know, but it's also really valuable for worsening neurologic signs and symptoms, especially for suspected nerve root impingement. If the MRI comes back and it is negative again, then at least you know, at least you've done the testing, at least the patient understands, the attorney knows, we understand exactly what the imaging is. It tells the story, the diagnostic story of that patient, and you can move from there. However, if it comes back positive, you have another thing that not only are you educating the patient on, it's having an effect on your treatment protocols, and it's also really telling the story in detail and bringing value to that case. It's very hard for opposite side adjusters or opposite side attorneys, to argue the validity of some of these diagnostic tests, and they will try. I mean, they will try to really tear down the value of a personal injury case, which, hurts the payments, but ultimately hurts the patient because they just don't get what they need. So let's move into the next slide. So when to use pain management, just going to give you a quick definition. Conservative treatment definition: conservative management is an approach to treating back pain, neck pain, and related spinal conditions, utilizing non-surgical treatment options, such as physical therapy, chiropractic medication, and injections. So we know that. But why to specifically use PM? And again, we don't see enough of this with outside providers. So who they are and what do they do? Basically, they're an MDDO, can practice a number of medical specialties. The main thing is that they are perfectly placed to co-manage spinal pathology with you. They specialize in spinal conditions. They work very well with chiropractors. We work with a huge network of them in the Chicagoland and Northwest Indiana area. They're able to prescribe the medications that are needed. They're definitely part of the conservative treatment team. When you're meeting the pain management, you want to make sure they err on the conservative side. They're just giving recommendations. They're really allowing you to do what you do. As far as treatment, to bring down those pain levels and help that patient. And then if they need to come on as an ancillary treatment, that you guys are working as one. And the protocols state that pain management, even if it comes to the injections, is just going to help you do more aggressive physical therapy and help that patient without hopefully having to go further up that medical chain. So the PM doc is also going to be great because it's a second medical opinion to the patient. It builds validity around your treatment plan, and there's someone else who can educate that patient on exactly what their process needs to be. Bottom line, it's a great resource, I think, for any chiro, and also from a business perspective, it's an opportunity to generate huge new referral source of patients when it comes to health, insured patients, cash patients, and everything else. That's a large number of referrals that we get into the network. When to refer to pain management, especially for spinal conditions. Again, it's going to be after that first re-exam, lack of significant progress with chiro care alone. And you have a positive MRI for spinal or disc or for set pathology that's just not responding, as well as you think it should to your treatment. And then how do you respond to pain management? Again, I'm going through this as fast as possible, trying to bring you real value, but still getting through this entire lecture. So how to refer to pain management is going to be just a bundle of those notes. You definitely want a specific referral sheet from that pain management office, but you also want to make sure that you have the MRI reports attached, you have your notes attached, or anything else that could be relevant to that case. You don't want the patient making multiple visits to some of these specialists. You want to have everything in hand. You want to have a good working relationship. You want to give it to them. They need to be on the same page as you, and you guys need to be having, close communication on what's going to happen with this patient. Next slide is when to use an ortho. So for this, we're just going to touch on some extra spinal, pathology. Most cases can be managed with a combination of chiro-PT, anti-inflammatories, etc. However, you can't get complacent. We see a lot of rotator cuff tears, clavicle fractures, rib fractures, patellar fractures, patella tendon tears. We go down the list, and I'm sure you guys see it as well. So never assume that if a patient was cleared after going to the hospital, they are clear of all serious underlying pathology. We've seen broken bones in the foot or the hand, glenohumeral separations, biceps tendon tears. Just as the start for the extensive list that may walk through the door, especially when you're dealing with auto accidents. So why do you want to refer to an ortho? Who are they and what do they do? Especially when it comes to this extremity pathology. It's important to remember that many of them are going to specialize in a specific region of the body. So know who you're referring to, and when we get into building the network, that's going to be really important because some orthopedic physicians are only going to specialize in specific regions. Some are only going to stay in the spine. Others are going to work on shoulders and other extremity areas. So it's really important to take an evidence-based, comprehensive treatment approach to care. Co-management of any injury, extremity or non-extremity, is going to be extremely important to the medical and to the legal cases. All right, so handling unattached cases. Our GIF didn't work here. So we had a line here trying to basically catch prey. So what this is referring to, handling unattached cases, is an unattached case can come from many different sources. And what I mean by unattached is just a fresh PI case, doesn't have representation. They want to go with the insurance company direct and have nothing to do with an attorney. But the point is it's a fresh accident, fresh injury, fresh case, fresh person that needs to be helped. So they can come from many different referral sources, including online marketing, offline marketing, medical referrals, like we discussed, your existing patient base. When you get an unrepresented accident, it's very important to know how to bring that patient the most value medically and legally, which is why that initial call is so important. So incoming calls. When it comes to initial calls, vetting and education is key. You want to help that person as much as possible on the medical side, and then educate them on not only the process of their personal injury, I don't want to say case because we don't want to dive too much into the legal, but what that process is going to be and how you can get them into the right hands, which would be sending them to a law firm. Oops, sorry about that, missed the slide. So vetting that first initial phone call is going to be extremely important to get a background, to get some details on this case. What was the date of injury? Were there any previous medical treatment? Did they go to the ER? Who was at fault? In some states, that's going to make a massive difference on the payment structure. Ask them to tell you a little bit about the accident specifically. Was there anyone else in the car? Did they lose consciousness? Do you have attorney representation? Do you know anything about that? Do you plan to get one? That's a really, really important phone call because it's going to kind of lay the stage, or lay the foundation rather, on what you need to do for this person going forward. And when it comes to just education in general, you need to, after you do that vetting deep dive, you need to educate them on both your plan, what you would suggest that they do medically, and what's the best way to proceed going forward, and why it's so important. Because again, you have some people who they might be in an extreme amount of pain and they don't want to come into the office for whatever reason. So it's your job to overcome those barriers and educate the patient. All right, so we want to make sure that they get the immediate checkup post-MVA. It's important for them to get looked at, especially if it's recent, as far as the accident goes, given all the compounding effects that can happen to spinal and to the spinal column and musculature after an MVA, even in low impact. And you guys have seen a lot of this before, especially when it comes to MVA, sports injuries. Something that seems minor can have major effects in the body. And that's on the treatment side. And then you want to dive into again, that educational component. So you've handled the medical. Now, what are you going to do with them? What advice are you going to give them on the other side of things? How do they want to finance the treatment? Do they have legal representation? Do they have med pay? Do they have auto insurance that they'd like to go through? Are they able to? Do they have health insurance? Are they a cash patient? And then you need to walk them through that entire process. So if it turns out that they do need legal representation, and I'm sorry for hesitating there, but I just would like to do so much of a deeper dive into this, but we are flying through this thing and running out of time. So if you do have a unattached case, being a matchmaker is really important, okay? If they have expressed interest in an attorney, or they want to hear more about basically why they should obtain one, you have to just touch on a couple key points. You aren't selling them, you're educating them, and you're just trying to get them in the right hands. Any of you in this space that have dealt with insurance companies when it comes to auto injuries, sometimes they can be great, sometimes they are terrible. And it just completely sometimes depends on the adjuster, the policy limits, and other things. The main thing is that even if they don't want attorney representation in the beginning, you're planting the seed, you've educated them, and then you can come back to it later on if, again, the patient's not getting what they need in all aspects. You really do have to explain that the attorney is going to look out for their best interest, fight to get their car fixed, fight for their settlement, and they have a lot of experience dealing with accidents and auto insurance companies. All right, so be a matchmaker. The severity of the injury is really, really crucial. The type of personal injury case is really, really crucial to look at, as is the personality types of the client. So if they do wish to speak to an attorney for a consult, make sure to pair them with the right firm for them. And that's going to depend on, do you need a good trial attorney for their case? Do you need a slip and fall specialist versus a motor vehicle specialist? And there are some subtleties there that we see a lot. And finally, the personality of the client. Are they going to need a lot of handling? Do you have a very large law firm that just doesn't put in the time really with the clients? Or is it a small, more boutique law firm, maybe a younger guy out of school or gal who is really dialed in and, gives that personal touch? So when it comes to handling attorney referrals, you've got to understand that handling the attorney referral gives you a lot of leverage, which is one of the main reasons why finding unattached cases can be an important part of building the PI side of your practice. The cost per lead for an attorney is extremely high. So the fact that you can provide quality leads could be huge. And in the end, if the insurance company isn't playing ball, with paying the medical bills or helping the client, you can always have this education discussion down the line with the patient. So when you actively have a PI case, you've gotten a PI case through your door. This person already has attorney representation. Communication, obviously with the patient, but definitely with the law firm is going to be key. You and your team has to be organized. You and your team has to be organized when it comes to the treatment. It's going to be crucial to communicate with not only the patient, but the firms on their cases. So you should be keeping them updated on the following: the initial lab date and time, any red flag findings, the need for immediate diagnostic imaging, specialist consults, any malingering, prolonged gaps in treatment, notes, including the initial re-exam final, should be sent promptly. And again, I'm trying to fly through this. Any specialist diagnostic reports should be obtained by you and sent to them. You want to be the bottleneck. You want to be the quarterback. You want to be the one who's the expert in this field, and you want to be their go-to. And we covered this. So none of these gifts are loading, but this was actually a goat that was ramming these puppies, and the theme of that is must play well with others. It's also very important in PI. Don't be the goat. Don't ram others. It's a team-based approach to care with anyone, medical providers, your team, that can benefit the patient's treatment, which also hand in hand bolsters the legal case. So you must play well with others. Especially the medical community. Pain management, orthopedic, neurosurgeons when needed for the spinal cases, ortho that focuses on extremity for the non-spinal injuries, diagnostic imaging and testing facilities for sure have to have them at your disposal. great ancillary referral source outside of the PI, but a must for the PI. Everyone has to work together, but you're in the driver's seat most of the time. And again, you're learning a lot, and they really help you through these cases. All right. Finally, when the case settles, understanding payment structure is key, not only from a short-term financial bottom line, but also a long-term perspective. You have to do what's fair for all the providers. That's all the medical providers, the attorney, and the client involved. You have to really understand the money. When it comes to MedPay, lien laws, payment timeframes, you need to know what to expect. You need to be able to communicate that to the patient, and you need to make sure that you are, again, playing well with others. Were you able to bill MedPay, or was MedPay available on your case? If you did tap into MedPay and you took money from MedPay, did that affect the end when the settlement came, and was it done in an unfair manner? So let's say the other providers that were involved really didn't have the chance to negotiate their bills as much. So this way you guys could all, including the attorney, take a common reduction, or a fair reduction, I guess I should say. Is there a specific lien law in your state that you need to know? And if so, do you know the details on it? That's crucial. We see that all the time in Illinois. We've gone to bat countless times with attorneys that we don't know, or law firms that we don't work with consistently, or I should say don't settle cases with consistently, who try to skirt past the lien law here in Illinois, which is a no-no. So what's the time frame for payment? I think that's also important to know. Was it a case that went to trial, arbitration? Again, could you use MedPay, or did you have to wait until the settlement? And what's a reasonable time frame for that? So the reason I'm touching on these briefly is because I think it's important for the context. I think you need to understand that when you're expecting the settlements, because again, we see a lot of people who get frustrated on the payment side of things because they don't really understand the details involved. So this is a state-specific question. It's a case-specific question. I can't dive into the details today just due to time constraints. So we're going to jump into documentation here. So documentation, this is huge, as it sets the stage for each case, tells the patient your story, or tells the patient's story rather, and your level of knowledge and detail show your competence level to the medical network and also the legal community. It's pretty basic, but very important. Take great notes. I can't emphasize this enough. You have to take detailed notes. You're telling the patient's story. It's going to make a huge difference when it comes to personal injury, settlements, the attorneys looking at you with credibility, the medical providers seeing how detailed and thorough you are. And to dive into some specifics on that, in order to take great notes, we're going to focus on the initial, the daily, and then the final. For the initial notes, don't focus on the accident per se, focus on the damage to the patient. You're not really an accident reconstructionist specialist. Where were they in the car? Where was the point of impact? Did they know it was going to happen? Did they get tense? Like, these all need to be documented in the notes. Were they wearing their seatbelt? Did they lose consciousness? Were they wearing airbags? Did they get burns? Did anything hit the vehicle? Did anything outside of the vehicle hit the vehicle that it was pushed into? Were there any bruises? Did they hit their head? And really, if you have multiple people in the same accident that you're treating, it's important to talk to people individually, not together, because you want to make sure that they're getting accurate representation from each person's point of view. Is there issues with their sleep, headaches, radiating pain? Make sure you're using all the intake forms, which it's very, very important, oswestry, ADL forms. Do they have any previous accidents, injuries, surgeries? If there was a previous accident, find out if there are residual symptoms or if they're still going through treatment. Document that. That's okay. You're just going to be accurate and tell the patient's story. Are there any red flags, blood pressure issues? It's important to go through the entire history. If someone went to you, if someone went to other doctors before going to you, what exactly was the outcome of that? Make sure you get those notes. And it's just really, really important during this initial exam to take great notes. I mean, it always is, but especially when you have an adjuster and you have opposite side counsel, I mean, they're literally, it's like you're writing a novel and they're reading your novel and they're editors and they're going to pick it apart. And whether they're medical providers or not, they're going to go through and what makes sense, what doesn't make sense. You're saying you're treating these people for 5 months, but you have like minimal diagnosis on here. It doesn't make sense. So that's where we see a lot of these issues too. So again, make sure you're doing a lot of the malingering tests, the orthoneuro tests. I mean, I don't have time to walk through all the different, testing procedures, but we'll just jump right into the daily note. So for the daily note, the regular visits, this one's going to be a little bit shorter. And I mean, we'll focus on the basics. So especially the subjective, it needs to change. Get the details, be specific, make sure you pull key points out of the patients. Do you have radiculopathy? Does your finger hurt? Are you having ankle pain? Because you guys know, like sometimes patients just don't tell you the full story. And it's really important during that initial and then during each of these daily notes to be detailed. As far as what exactly the patient is experiencing. Radiating pain questions are very important. ADLs, what the injury is preventing them from doing, and the actual loss of enjoyment, to their life. And then for the final notes, make sure you have a visual diagram with a pain scale as you did in the initial. You want to fill out all the forms they did on the initial. So this way things are matching and you can see the patient progression from start to finish. You need to document, especially if there's any kind of exacerbation or need for future care that they will need, maybe an estimate on how much that should cost. And then when it comes to the causation, did the actual accident cause this specific pathology? I think it's important to state that it is my opinion that the above described injuries are more likely than not. Because you are not 100% sure, but in your opinion, you're more likely than not they're related to that date of accident. That's a really important statement. I would never put MMI. I would put MMI with chiropractic care, just because, again, on the back end, we see a lot of cases that are finished with chiropractic care, but then need medical care afterwards. Make sure you're evaluating all the areas you were treating initially to make sure they're resolved. All right, so billing for personal injury cases, billing correctly and avoiding common errors makes a big difference when it comes to PI cases. Just like with records, the billing tells a story of the treatment you've done and the level of detail you put into it. We're just going to discuss really quickly the to-dos and then what to avoid when it comes to personal injury billing. To-do. So if you're billing for something, make sure you do the thing you're billing for. You'd be surprised how often that happens. Patients may get deposed, so make sure you've done everything correctly and educated the patient on the what and the why you were actually doing those things. All the adjustment codes need to be supported by diagnostic codes. You can't adjust the thoracic spine without a diagnosis in the thoracic spine, and that goes for anywhere else in the body. So if you're treating an area, make sure there's a corresponding diagnosis code to the adjustment code or treatment code. If you are adjusting the thoracic spine, again, you must have a diagnosis. So codes should change as the patient progresses. So you might move from passive in the beginning to more active modalities. It's going to be really important, again, that this is not a cookie cutter approach. Like, you're a physician, you're smart, you're dialed in, you know this space, you're treating it as such. And as the patient is progressing, and that might be at every re-exam, that might be every visit, you're actively changing the treatment modalities. And codes should definitely be changed as frequently as needed. Don't get lazy. Don't copy and paste. The details matter. It's not like no one's going to see these notes, even if it's just for somebody else to see. I mean, it's especially important. You have opposite side counsel that's going to go through these. You have adjusters. They're going to go through every detail of your work, and you have to tell. It's actually your obligation, in my opinion, to tell the stories, to tell the patient's story in the correct way. And that's really what the bills and records. You're also telling your diagnostic ability and your story to the firms representing the patient, so they understand, how detailed you are and how dialed in you are to the space. If you give them anything to take home, make sure they're putting that in the file. And again, if you're treating more, we're going to get to the more than one passenger thing. If you're treating more than one patient that was in the same accident, make sure you don't give them cookie cutter treatment again. I mean, it's one of those things where, there could potentially be a lot of overlap. However, specific care for a specific patient. Avoid the cookie cutter treatments for everyone. And then again, perform and bill the re-exams every 3 to 4 weeks, 8 to 12 visits. They're the standard of care. We have to do periodic re-exams. They're needed to evaluate the patient progress, determine future treatment recommendations. It's a good opportunity to touch base with the attorney. It's a good opportunity to touch base with the medical providers. And then bill for multiple units if you've done multiple units. Make sure you maximize your billing for those units. And please review your specific region's fee schedule. It's okay to be on the higher end of the fee schedule, but you don't want to be outlandish. Somewhere in the middle, obviously, is the best. You will gain a track record with the auto insurance companies, as you know. And visit prices should fluctuate depending on treatments done that day. I mean, this is basic billing here. Make sure to put all the services done for that day in the note. Let's go to the next slide. So proper diagnosis. We'll go through this quickly. Points to remember with proper diagnosis. You have to use codes for all the areas treated. The most valuable codes are going to be the codes that correspond to the largest injuries. So make sure you're getting into sleep, you're getting into radiating pain, which jumps into the importance of MRI because it may be able to document, or EMG, NCV. You can document those injuries with hard diagnostic findings, which in turn, bolster that case. Headaches, make sure to diagnose everything. Could be 10, 15 codes, sometimes up to 20 per patient. But the top 4 give the most weight. The top complaint really needs to be in there, as does everything else. And finally, don't underdiagnose. All right, as we dive into the marketing pillar here, hope I'm not talking too fast. Again, I just had a lot of material I wanted to get out to everybody. So when it comes to marketing, we're going to dive into just 2 components: marketing with the medical field and with the attorneys. I wish these GIFs worked. So MD marketing. So MD marketing for some can feel like walking into a lion's den, hence the picture, but it doesn't have to be. And it's a really great way to increase the volume of your practice, PI and otherwise. And if you are specializing in PI treatment, I mean, it's a must if you're serious about being an expert in this field. Sorry, I was getting some feedback there for a second. So when it comes to MD marketing and networking, the main reasons for having a medical network can be broken down just into the following. You got patient care, you want to build that legal case, and you want to build credibility with the legal community, and you want to get non-PI health insurance referrals from the MDs. So let us start with why you need a network for patient care. So personal injury patients, they're obviously going to present with a wide variety of pathology based on the forces involved in car accidents. It's very important to be prepared for anything that walks into the clinic outside of the typical sprain strains, and is not uncommon for us to see, or anybody who out there who specializes in auto accidents to see, fractures, AC joint separations, head and face injuries, significant disc pathology, ligament and tendon tears. And having an excellent team of medical providers in place for most referrals will really just improve the treatment of the PI patients. Having a medical network to utilize is also necessary when you're playing quarterback on the case, and it makes you the point person for the patient. For those MDs, they're going to fall back to you. They're going to want to discuss the case with you. And for the attorneys, which it's going to do the same thing. You're going to be that point person on the case, which is going to lead to more referrals. So I rob banks. That's where the money is. It's a fitting quote for here when it comes to attorney networking. And that's because there are so many ways to get unrepresented and represented PI cases when it comes to marketing. But one of the important ways I'm going to say is just attorney networking. You want to build a rapport with the attorneys to increase your PI business. Attorneys have the clients already. They want to work with people who have a detailed and organized approach to treatment. They want their clients to be helped, and they want a resource to send them to or to recommend, or just somebody in the community that that their client can look up who specializes in the space. But you have to have the expertise to be the point person for treatment. You have to play the quarterback. You keep the treatment referrals and the recommendations organized, and that is extremely important, which falls back to the excellent and comprehensive treatment can strengthen the legal case. So adjusters and auto insurance companies, much like medical insurance companies, they want to limit the amount they pay out the doctors for treatment. the insured that they're supposed to protect, and basically the firms they want to represent. So we're dumping into the attorney marketing, why you want to network with attorneys. So in many cases, those involved in the accidents just want treatment covered. They want to recover from the accident. They want the car and the property damage fixed, and they want protection financially if they lose time at work. That's it. They want to get back to their life when you're a patient involved in an accident. However, frequently this doesn't occur. The auto insurance companies fight. They don't want to pay for treatment, and they can make the process difficult for everyone involved, hence the need for attorney representation. So if you play your cards right, the system's an excellent opportunity for you to show real value to everyone involved. With your treatment skills, you're in a prime position to help a lot of injured people get better. You're in a great position to build a PI referral source for new patients with interesting injuries and to add income stream into the practice. So when you are networking with attorneys, who do you want to network? Working with the right attorneys and what to look for when approaching law firms is very important. There are several variables to consider when trying to increase PI business. Getting dialed in with the underlying right firms is crucial to building a strong foundation for increased PI patients. Like anything else, not every attorney is going to be the right fit for you. They should share your passion for helping people. They should also be there to look out for both their clients, but also your needs, especially when it comes time for reductions or anything else on the back end on the payment side. And there are state rules and regulations in place that you need to be well versed in to protect both the patient and the doctor, so that the attorney should actually be well versed in these too, so he's not taking advantage of that process. Some important elements to look for in a law firm that you may want to approach is volume. How many cases does that firm get monthly? A good indicator of volume is what their marketing looks like. Do they have billboards, TVs, commercials, radios, online presence, etc.? I mean, you guys understand the game. The higher volume of clients they get equals a higher percentage that may be unattached. Maybe they don't have physicians of their own. Maybe they don't have health insurance. They want to work on a lien, and you're there to really just get that person better, and you'll worry about payment as it comes on the back end. The unattached cases, I mean, those are clients without their own doctors. So it's really, really important that people in the legal community see you as a resource for those patients. And if you're positioned correctly, we've seen it time and time again, you can be a valuable resource for them. What region does the attorney practice in? Is there a specific region or market in, I should say? Are there certain regions of your city where their clients come from? Is there a specific area, white collar versus blue collar, or socio-demographic area that has the highest number of PI cases in your city? It depends on the firm, but generally speaking, a higher percentage of PI clients tend to be lower to middle income areas. This is for several reasons. These areas have more blue-collar workers, demographics, including more people who drive for a living. Given the average income level in certain areas, there's a higher likelihood of a person either being without health insurance, or maybe they have health insurance with such a high deductible, they just rarely see their own doctor. Both of these points are crucial for you and leave a real opportunity. And finally, the thing you want to look for when you're networking with attorneys is the attorney reputation and firm specialty. Does this firm have a solid reputation in the community? Do you know any docs that have been on cases with them in the past, which may be a really good idea to find out a way about the firm? How long has the firm been in business? Do you have any current patients that have been represented by them in an accident or other legal matters? So finding unattached cases is going to be crucial. You're going to do this through meetings, reputation, your unrepped cases that you're going to be able to send out to the attorneys, your online, your offline strategies. I wish I could dive more into this. I just don't have the time here today. But it basically will boil down to your existing patient base, your online strategies like Google Ads, YouTube, pre-roll, Instagram, Facebook, LinkedIn, direct messaging, and a whole host of other ways to connect with your target audience. And then the offline strategies, which include, yourself, a marketing rep, going out, setting up strategic meetings with attorneys, auto insurance companies, commercial trucking companies, drivers, ride-sharing services like Uber and Lyft, limo and cab companies to offer your services. Get your name out there, be the expert in your field when you're called upon. All right, so wrapping up here, I hope I wasn't talking too fast for everybody. The bottom line is what I went through today. This is just the tip of the iceberg. It's 45 years of personal injury experience between myself and my partner. It's really hard to boil this down in depth, giving all the context and insight in 45 minutes. These three main pillars that we touched on today were the biggest secrets that help us grow from 0 to 120 new PI patients per month and actively manage all of the cases that we do. All I do every day is work to acquire and manage personal injury cases, have conversations with different medical providers and chiropractors about these cases, and just get people the best care possible for their injury and get them better. I've trained over 50 doctors, DCs, and MDs on the process, how to build, document, and treat PI patients the right way. After training several chiros, I knew basically on this process again and again. And after a lot of just being told that we should share this course, we should develop a course, after probably about a year and a half, we decided that it was just time to do that. I just feel like there's a ton of non-practical information out there that's very confusing in the space, including people getting cases but not really knowing the craft. It hurts patient outcomes and financial outcomes. Our team has decided to just put all of this experience and knowledge into a 12-week course that has every single thing we could think of in this space. And we deal with it on a daily. I mean, a lot. I mean, we brain dumped everything from PI management, treatment, marketing, case building, networking. We have templates, we have examples, we have videos, other educational material. You're going to get three months coaching on the back ends. So this is just going to be a plug and play system. We've brought a lot of value to a lot of different chiros out there. We just want to replicate this with you in your office. We're running out of time, so here are just a couple quick testimonials. And then finally, Personal Injury Expert Secrets is the name of our course. We're launching our first group of students into the course on October 1st. Right now, we're taking applications. There are going to be 100 spots for this first course. If you're interested in being put on the waiting list when we open up for sales, please just go to piexpertsecrets.com. Fill out just a quick application. We will be in touch with further details. I'll also send you a free video series to do a deeper dive. This first course is going to be really the one to get into. It's going to be the lowest price point we ever offer. And really, though, everything we have is going to be dumped into this. We've been working on this for at least a year and a half. And again, we're just trying to bring the most value in PI to everyone. So hope to see you there. If you have any questions, I'm looking forward to answering them. And that was the webinar.
Thank you so much, Dr. Calarco. Really do encourage y'all go visit piexpertsecrets.com to look more into their inaugural class. What better time to get involved or learn more than when you can get it at the best available pricing? Just a reminder, let's see, I want to see. Oh, here we go. I have one question. I have a couple of questions. The first one is, what is MedPay?
Oh, so MedPay is a specific policy that goes on the auto insurance that allows the physician or any medical provider to tap into a payment source right away versus having to use, let's say, the person's health insurance or having to work on a lien with a law firm.
Great. And then I have another question that says, I've had insurance deny claims when the diagnosis codes have changed. Have you also had problems with this?
I would have to dive into the specifics on that, and I have not had a problem with that. And again, I think that goes back to the case management and the kind of the corroborating notes between us and the medical providers. And even on the ones that we have had no medical on, let's say just chiro only, we have not noticed that. And that's kind of a insurance specific question, attorney specific, if they are represented. So that's, we'd have to dive into more detail on that one.
All right, everyone. Well, just now I had several people who messaged me and asked if the webinar was recorded, and yes, it was, and a link to the recording will be sent to everyone afterward, probably within the next hour. So don't worry if you want to go back and listen to it, because it was a lot of information in a short amount of time, and there were several of you that wanted to share this with your entire team. We will be sure to have Dr. Calarco back again in the future. And thank you so much, Dr. Calarco, for taking time out of your busy schedule to be here today.
No, thank you guys. This was my first webinar. We're opening this up. I'm just excited to get the information out there, and I hope it wasn't too fast for everybody.
You did an amazing job for your first webinar. So
thank you. Appreciate the opportunity.
Just a reminder, next week we have Dr. Stuart Burnson. He's going to be talking about increasing your practice value. That webinar will be, well, not next week, because next week is 4th of July week. So let me change that up. In 2 weeks from today, we will have Dr. Stuart Burnson here talking about increasing practice value. I know several of you are going to be closing up for part of the week next week to enjoy the 4th of July holiday, and I hope y'all have an amazing time and get a little R&R, because you definitely deserve it. So make sure you go ahead and register early and secure your seat for that next webinar. You can click register now on your screen to go ahead and get registered. I hope everyone has an amazing day, a fabulous week, and we'll see you in 2 weeks. Bye-bye, everyone.